This is about asset-based thinking and doing. And the reason you're here is because I heard the work that you are doing and the work that you did. And we wanted to learn a little bit more about that work, your experience, practical aspects of it, not just the theoretical models that many people really talked about, and how in practical terms we can transform something which seems ethereal sometimes into something that people can grab and take forward. So, but before that, I'm just going to ask you if you do a little introduction of yourself or who you are, where you worked, and where you're working now, and then we can just start the podcast itself. So, up to you, Mick.
Well,
Thank you.
cheers, thank you, and hi everybody. So I'm Mick Ward. If you're a Twitter person, I'm at Mick Modern. Although, as well as all the stuff around asset base and other sort of stuff in this realm, you may get the odd rant about Leeds United as well, which does set me up. Everyone might be turning off now, but I am very much a Leeds lad, born and bred in Leeds. But probably more importantly, I worked in adult social care and health in Leeds my entire working life, literally man and boy. I ended up towards the end of my career being the Deputy Director of Health and Care, a joint appointment between the Council and the NHS, and I was responsible for commissioning. So all those things that you'd expect that sit in that world, home care, care homes, community equipment, mental health, learning disability day services, etc., all those things. But within that area, we became more and more interested in the potential of ABCD, asset-based community development. I'll generally use ABCD as a shorthand for that. And obviously that's what I'm going to reflect back on in discussing with Ram. But I actually retired from full-time work 2 years ago. I'm now 65, so I'm slightly earlier. Looking at all those years I'd added up. Both still while I was in work, we actually refined my role and created a post, Chief Officer for Transformation and Innovation, very grand title, which covered a number of areas, but particularly having that lead role around ABCD. And then as I retired, I was very keen of all the things I was involved in throughout my career. It was ABCD that I was beginning to see real potential. So I wanted to carry on doing that work. And the sort of international leads, in my opinion, but they do a lot of work in the UK as well as in Europe and the rest of the world, an organisation called Nurture Development, set up by one of the big thinkers around ABCD, a guy called Cormac Russell. And so in discussions with Cormac, because in Leeds we've done a lot of practical implementation of ABCD, he was keen to sort of pull that in and link that to what they were doing around theory. And so we initially worked on developing what is in effect, I use the word course loosely, it's a bit more than a course, around how organisations can move towards ABCD and strength-based ways of thinking. And that's mostly what I do now, besides other bits and pieces that you'd expect from a retired person and volunteering and all that sort of stuff.
Yes. Thank you, Mick. That's quite comprehensive and quite extensive life, and interesting as well how asset-based really seems to be permeated now quite a lot of the functions. So with that in mind, I think that this would be the main question that opens for more type of conversation is how do you think, considering that ultimate experience of working through the local authority and the ABCD model, how do you think local authorities can reframe and perhaps rethink the goals, the output, what they're looking for to maximize those asset models in a practical way? How do you think it can be?
I think a couple of things. But the first thing, I'm going to be a bit naughty and turn the question a bit on its head, because actually, I don't think it is about local authorities or other organisations like NHS reframing their goals. I think it's about understanding the potential of ABCD to assist in reaching those goals. That's the most important thing. And by that, I think it's a mixture of using ABCD in two very broad ways. One of which is directly the implementation of asset-based community development, implementing the ABCD framework, which I'll come back to. And my experience shows that is where you get your big bang for your bucks. in terms of outcomes, invest to save, etc. The second thing is to take that learning and link it to other similar things like strength-based work and change the ways of working of staff or services, either commissioned or directly provided, to have a more strength-based focus. And the reason I turn it on its head again is one of the really big learning points for us in Leeds, but I've seen similar in other places that are really pushing ABCD further. Cities like Bristol, some of the work in York, what's been developing in Newcastle, some of the stuff you're touching on around Leicestershire.
Yes.
So two things really happened for us. So there's a pre-bit. So we had started to fund ABCD, and that is the funding of community builders working in small neighbourhoods with a role to connect people together, to support people, to have friendships, to ensure local people identified what needs to change and lead the change. That's what I mean by an ABCD framework. And we were collecting from those people, in effect, the stories of what was happening. How were people coming together? What were they working on? What was the impact of that? And we funded this initially through adult social care, because we saw bringing those people together as having massive health and care benefits, particularly around things like tackling loneliness. But as we collected those stories of what was happening, we were seeing much broader impact. At the same time, going back to people like Cormac Russell and the theory stuff, they were writing a lot, and Cormac wrote a really interesting thing talking about the essential nature of community. I had a bit in it called the 7 community functions. Yes. And in those functions, he listed things like showing security, stewarding ecology, contributing to local food, contributing to local economy, raising kids, and of course, enabling health, providing care. And of course, what was interesting to us were, on the one hand, you read those, you think, oh, isn't that our job? Isn't that the job of the local authority, the NHS, to do all that? So it was quite interesting, somebody saying, that's what communities can do. And at the same time, the stories we were hearing from our community builders were examples in all those areas of people coming together to do things around the environment, about community cohesion, about raising kids. So although our core focus was around care and support, we were seeing all those other things. And that gave us both the confidence to invest further in ABCD, but gradually to take it on as a much more council-wide approach.
So you think then that's quite interesting, because it almost comes into my next sort of question, but I'm going to merge it with sort of thinking around that. Because the question I had is, how do you think, and although I'm basing it on local authority because I work for the local authority, but understanding that basically what you just said, there is community response, community cohesion, community collaboration beyond perhaps the topics. So I don't know, for example, if someone has got an autism group, which I worked with in the past, or a dementia-friendly group, or they have I don't know, some classes, adult classes they do in the community house, or some yoga classes. All of those are, but they are separated, if you want. They are individually. That doesn't create perhaps the cohesion of having something that everyone feels part of. So, and those assets are and exist already in those communities. So 2 questions. So one quick one is, so do you think, for what I understood from what you're saying, that then public sector, local authorities, public sector are almost like, in a way, stewardships and provide information, support, capacity perhaps, and occasionally funding, but what you suggest then in those conditions exist already in communities and you are taking care of those?
Yeah, I think that stewardship phrase you used, or nurturing, I think that's one of the ways. So I think we're saying 2 things. So one of which is they already exist, but we're not fully aware of them. But the second thing is that they don't exist across the board and they could grow. But we talk a lot about proliferation, not industrialization. So it's not about saying you need everything the same in every neighborhood.
Yes.
You know, because the community themselves will identify the best way to do that, but you can support it. An interesting example, and I also, my local authority, like I said, literally man and boy, 46 years, bum straight through from being 16, So I was very much, had local authority stick a lot through me, but I began to see that potential of community stuff. And I think that was the real shift, that you don't have to resolve everything through services, that there are ways of bringing people together. And the key example was, as we advance with ABCD and saw its potential, and we had that support from the leadership. My boss is the director of Adults and Health in Leeds, woman, Kath Roth. In discussions with her, we talked increasingly about the importance of people having friends. And we wrote into my role, and I think I had the best KPI of any cancer worker, which was for everybody in Leeds to have 3 good friends. And I remember talking to some people like that, and they thought, "What, is that the job of the council?" And some people would push against that, and I was going, "Yeah, I think it is," in the sense of, if you think of the role of a local authority, a modern local authority, about it's there for all the people, and the evidence on people being connected and having good friends and its benefits to you is huge. And this isn't forcing everyone to have a name. I think we dropped the 3 and made it everyone to have good friends now. But that was a real powerful thing. But you don't enable that through traditional services. Even if you go all the way down to things like befriending groups, they still service land a bit, And there are some things around the edges, like I'm a big fan of things like shared lives and things like that. But what ABCD came about was a way of helping that happen. But you do need a framework. I think you need to understand its potential, and then as workers start to think, how can I work in an asset-based way? How does that affect my role? And that's not just people in health and care, it's whether you work in culture or economy or housing or planning. How can I understand the assets in my local community and nurture those, and not just fix things all the time? But there is an ABCD framework. As a council, you can employ community builders like they do in Bristol, or in areas where they have local area coordination. Or you can do what we did in Leeds, is you commission organisations to do it. And we deliberately commissioned small, local third sector organisations. Interestingly, we started with the ones we knew, the ones who worked in the world of social care. But we quickly learned that that wasn't the key factor. The key factor was local knowledge and being part of that local community. So towards, latterly, and some of the last couple of years since I've left, it's been picked up by other people. Some of those host organisations, there's a faith group, there's a theatre company, for example, but it's respected and local, and that is the key element. And then from that, when people come together, they will naturally do things that benefit the outcomes you're after, which is why I was putting on my head your initial question. So we got enough out of it in adult social care and things like tackling loneliness, people engaging with each other about their health, supporting each other around well-being, to make that worth an investment. But actually now other bits of the directorate have started investing in it. You're seeing roles within the council nudge towards more that focus. I could give you a couple of examples, or do you want to just cover another area?
Those examples may come quite relevant actually with my next point. What I'm curious, because I haven't found the answer yet, to be honest, is those and another piece of work I've got, I call it champions. For better word, champions in those communities, champions that they know the communities to the extent that they know what is happening, and they know, you're talking about those 3 friends. So they know quite a few multiple number of people, so they're able to keep those together. how do you ensure that those people remain active and engaged? Because one of the issues that we experience, and probably you did experience that as well when you were at the council, is that you start sometimes very good projects with very good ideas about how to work with communities and do something quite positive. But it seems to be in that old-fashioned way of doing things to people. And then when you leave, it's a vacuum there. So that approach, at least the theory, is that you ensure that those people remain, are retained, and they are in the long term. How can you, not yourself directly, but how can we, and how those communities can retain, sustain, and maintain those roles to ensure that that keeps going and that doesn't disappear when that person goes?
Okay, I think two things, and this is one of the many contradictions. So on the one hand, I think the role of the community builder, that's the sort of paid role in all this, is key and needs funding and resourcing, whether they're employed by the council or by a third sector organisation. So you need long-term commitment to fund those. Or in organisations that are already operating, doing community work, can they nudge a post to be more community development than community delivery? That's what we're seeking for. And that gives the energy in that community, backed up by, other tools of ABCD, like doing asset mapping. I'm a big fan of small sparks funding, where you give out tiny bits of money. And I'm talking 50 quid, 100 quid to make stuff happen. Big fan of. So that's a bit you can do, and you can resource that through a council. But the other thing, actually, and this is the contradiction, is to be calm about some things will end. Because some people will get together for a knitting at a group because of the energy of one person, and then that person moves on and dies or thinks of doing something else, and it drifts away. But what ABCD naturally does with the role of community builder will be constantly going out and trying to find those people and encourage and nurture them. Something else will take its place. You do need that nurturing and that spark to make it happen. And one of my favourite community builders, for example, works in an area in Leeds. She sits in the pub every Thursday evening between, I think, 5 and 8. Everybody knows she's there. So if you want a bit of advice and support and information, she'll do that. If you don't, you don't, But things go at the speed of trust. I think the other thing, and this was quite a challenge when we were first doing this, in that commissioning provider relationship, we were saying to the organisations, this is not about ticking these outputs. It's about working in a different way. And that will take time. So we don't mind if nothing happens in the first few months. You go out there, we would say to community builder, go to every coffee morning, go to every cafe, walk the streets, find that will take time. Do not try and fill that vacuum by putting something on. So it's not up to you to organise a walking group or a Zumba group or a train spotting group. It's up to you to find somebody whose passion is train spotting, or whose interest is people all live in the same block of flats, and just encourage that to come together.